Diabetes is a disease that occurs when your blood sugar is too high. At the present time, diabetes can be cured, but it can be managed and controlled. Here are the things that you need to know about diabetes. Did you know that you might be at a higher risk of having diabetes before or during your pregnancy? Yes, it can happen. If you have noticed any symptoms of polydipsia, polyphagia, and polyuria these past few weeks, it is essential to seek immediate care to your trusted OB/GYN doctor. Being a Filipino, belonging to the reproductive age 18 to 45 years old, having a BMI of greater than 30 kilograms per meter square prior to pregnancy, having a first-degree relative that has been diagnosed with diabetes mellitus, has a previous delivery of a baby weighing more than 4 kilograms, or with a diagnosed condition called polycystic ovarian syndrome, you might be at an increased risk of having overt or gestational diabetes mellitus. On the first prenatal visit, the following tests are requested. Fasting blood sugar. It requires at least 8 hours of fasting. Random blood sugar. It is done by pricking the finger to draw a small drop of blood. This blood is then wiped into a test strip that will give a glucose reading. No fasting is required. Hemoglobin A1C. A blood sample is taken from the patient's arm. It shows what the average amount of glucose attached to hemoglobin has been over the past 3 months. 2-hour 75-gram oral glucose tolerance test. Before the test begins, sample of blood will be taken. You will then be asked to drink a liquid containing 75 grams of glucose. Your blood will be taken again every 30 to 60 minutes after you drink the solution. What are the possible complications that you may develop from diabetes mellitus during pregnancy? A diabetic patient with poor glycemic control may be at risk of having a miscarriage, stillbirth, or unexplained fetal demise. She may also predispose the fetus of developing malformation, particularly cardiac defects such as cardiomyopathy, which then may progress into an adult cardiac disease. She may also have a polyhydramnios or increased amniotic fluid, which may trigger preterm labor, premature rupture of the bag of water, abnormal fetal position, and umbilical cord prolapse. She can also develop preeclampsia, which is a hypertensive disorder during pregnancy, which is also a risk factor for premature birth. High insulin levels in the mother may cause for the baby to be macrosomic or be large for its gestational age, which may result to an elective or emergency cesarean delivery. But if the mother would undergo a trial of labor or vaginal delivery, she might have an abnormal labor pattern or shoulder dystocia, wherein the baby's shoulders are entrapped inside, which may cause genital tract lacerations on the mother or a brachial plexus injury on the baby. For the maternal complications after delivery, there is a 40% chance that she will have a diabetes on her subsequent pregnancies and a 50% likelihood that she would develop overt diabetes within 20 years. The patient may also develop diabetic nephropathy or kidney disease, neuropathy or having pins and needle sensation on the extremities, diabetic retinopathy that may cause blindness. They may also be prone to infections such as Candida vulvovaginitis, urinary and respiratory tract infections. They may also develop cardiovascular complications such as chronic hypertension, atherosclerosis, and coronary heart disease. Lastly, she may develop diabetic ketoacidosis, which is a life-threatening condition as the diabetes worsens. For the neonatal complications, upon delivery, the baby might develop hypoglycemia within minutes of birth. The baby is also at risk of developing polycythemia vera, which is a blood disorder that leads to increased bilirubin, hence jaundice. The baby might inherit the metabolic syndrome, which is comprised of hypertension, insulin resistance, visceral obesity, low good cholesterol, and high levels of bad cholesterol. Another is electrolyte imbalance such as hypocalcemia and hypomagnesemia, a heart disease such as cardiomyopathy, and lastly, respiratory distress syndrome due to prematurity of the lungs upon delivery. For a healthy pregnancy, always have yourself checked by a doctor to know your process and determine interventions for possible complications. In your second trimester, the ultrasound is a good way of knowing your baby's condition and assess for heart disorders. Your alpha-fetoprotein may also be tested to know if your baby has neural tube defects. Monitor your blood glucose every day upon waking up and after each meal to help prevent the development of complications. At 32 to 34 weeks, your doctor may ask you to come back for a biophysical profile scoring and contraction stress testing. This is used to determine your baby's status inside the womb. You will also be asked to frequently monitor your baby's movement inside your belly. And if you feel something unusual, seek help immediately. When you are nearing your delivery date, you will be assessed for fundic height and an ultrasound may be taken to estimate your baby's weight and if a normal vaginal birth is possible. To prevent or minimize complications associated with diabetes mellitus, you should take your medications as prescribed by your doctor. Monitor your blood sugar closely as well as your blood pressure. Keep a balanced diet with regularly scheduled meals. Keep yourself well hydrated and get plenty of fluids. Exercise regularly. See your doctor regularly to monitor for complications. Visit your ophthalmologist at least once a year for a comprehensive eye exam to screen for retinopathy, cataract, and glaucoma. Visit your doctor at least once a year for blood tests, for BUN and creatinine, to measure your kidney function. Your doctor should also check your urine once a year for protein. To prevent diabetes complications involving the feet and legs, keep your feet clean and moist. Wear properly fitting shoes and clean socks. Do not walk barefoot. Take warm showers, not hot. Examine your feet every day for evidence of skin breakdown, sores or ulcers, and see your doctor for any foot injury or ulcer and do not treat them by yourself.